Welcome to Global Health Guide, your trusted source for reliable health information that really matters. If you care about your health, your family's well-being, and making smart choices, you're in the right place. Today, we're diving deep into a topic that still creates curiosity, questions, and even a little fear: the COVID-19 vaccines of 2020 and beyond. What are their possible long-term effects? Are there side effects we should be aware of today, 4 to 5 years later? And most importantly, what can you do to stay safe and healthy in the future? Stay with us, because we're breaking down the facts in simple, clear language. And don't forget to hit that subscribe button to stay ahead of health news that truly impacts you. Let's begin by going back to 2020. The world was facing a crisis, a pandemic that changed lives, economies, and healthcare systems. Vaccines became the hope of billions. These vaccines, developed at record speed, were rolled out across the globe to help prevent severe illness, hospitalizations, and deaths. And they worked. Millions of lives were saved. But naturally, with anything new, people wondered, what about long-term effects? Could there be risks we don't yet know about? First, let's clear up one important point. According to leading health bodies like the World Health Organization, the NHS, and the CDC, serious long-term side effects from vaccines are extremely rare. Most vaccine-related side effects occur within the first 2 months of receiving a dose. That's why vaccine safety trials follow people closely during that period. In fact, vaccines in history, whether for measles, polio, or influenza A, have shown us that if side effects happen, they typically appear early, not years later. But that doesn't mean people don't have ongoing concerns. Many ask, what about heart health? What about immune system impacts? What about nervous system disorders? Let's break these down clearly. The heart health. There have been reports, though rare, of conditions like myocarditis, inflammation of the heart muscle, or pericarditis, inflammation of the heart lining, especially among younger males after mRNA vaccines. However, the risk is small, and most cases were mild and resolved with treatment. Plus, COVID-19 infection itself carries a much higher risk of heart issues than the vaccine does. The immune system impacts. Some people worry the vaccine could weaken or overload the immune system. The science shows the opposite. The vaccine trains your immune system to recognize and fight the virus, adding a layer of defense without weakening natural immunity. Long-term immune damage from vaccines has not been proven in any credible study. The nervous system concerns. Some have feared links between vaccines and conditions like Guillain-Barré copyright syndrome or blood clotting disorders. Again, these are extremely rare, and the risk is far lower than complications seen with COVID-19 itself. Monitoring systems worldwide continue to track and study these issues to keep people safe. Now let's answer a question that's on many people's minds. What should I do if I'm worried about possible side effects today, in 2025? First, don't panic. If you've had your vaccines years ago and you're feeling fine, that's a great sign. Remember, serious side effects would typically have shown up early. But if you do have any symptoms that concern you, like unusual chest pain, shortness of breath, or neurological signs, don't delay. See your doctor. Most side effects, when caught early, can be managed effectively. What about prevention? Is there anything you can do today to protect your health long term, whether you've had the vaccine or not? The answer is yes, and these steps help everyone, vaccinated or not. Prioritize heart health. Eat a balanced diet rich in fruits, vegetables, and whole grains. Exercise regularly. Aim for at least 30 minutes of movement a day, and keep stress in check through mindfulness or relaxation techniques. Strengthen immunity naturally. Get adequate sleep. Stay hydrated. Don't smoke. Limit excessive alcohol. These small, daily choices build resilience over time. Go for regular checkups. Routine health screenings can catch potential issues early, whether they're related to vaccination or not. Stay connected with your GP or healthcare provider. Stay informed, but from reliable sources. Social media is full of myths and fear-based messaging about vaccines and health. Stick to updates from trusted medical organizations like the NHS, WHO, or your local health authority. Before we end, here's one final important point. Vaccines A, including those for COVID-19, were developed to protect communities and reduce the devastating impact of a deadly virus, and they have succeeded in that mission. While it's natural to have questions and want to understand long-term safety, science so far has shown us that the benefits have far outweighed the risks. Negation. So what do you think? Do you still have concerns about long-term side effects, or do you feel reassured? Tell us in the comments. We love hearing your thoughts. And if you found this video helpful, give it a thumbs up, share it with friends or family, and subscribe to Global Health Guide. Together, let's stay informed, stay healthy, and support one another with facts, not fear. See you in the next video.